Hey everyone, Monique here with Nose Prints. Today we're going to be talking about a disease called cognitive dysfunction syndrome. And it's basically dementia or senility in older dogs, like Mr. Bishy here. Bishop is 11 and a half years old, and he was actually diagnosed with early stage of cognitive dysfunction syndrome. The reason why I even had one of my vets look at him was because he was showing some signs. He was changing a little bit in behavior. Now, I know a lot of you have senior pets, and you probably think that it's just old age, that it's a normal aging process when they start doing weird things. Some of it is true, but there is a disease that causes some of these symptoms that you can actually treat and slow the process down. Cognitive dysfunction syndrome is very similar to Alzheimer's, where they have that plaque buildup in their brain. So it's not something we can reverse, but if we can diagnose it early on, we can start treatments earlier and slow the disease process. We could never make it go away, right? What Bishop started doing was he actually started urinating in the house just because he had to go, and he wasn't asking to go outside, which he always did. So first we did a urinalysis to make sure that he didn't have a urinary tract infection. We ran some blood work to make sure that his kidney function was working properly. Once we ruled all of that out, we realized that this was a sign for this disease. He was actually forgetting to ask to go outside, and then it was too late. All of a sudden he had to go, so he just went. The other things that you could be looking for are they don't really interact with you for a long period of time. They kind of forget you. They rather just kind of sleep a lot in a corner. They don't move around the house too often. They get disoriented. He doesn't have any of that yet. I'm hoping we'll keep that from happening, right? The biggest thing for you is to look for different signs: disorientation, their behavior changing, going to the bathroom, like I explained. The other thing is not greeting you at the door when you get home like they used to. Any type of behavior change like that is something that you want to talk to your vet about. Sometimes it can be a medical problem, and you definitely want to rule those out first. Then you go into the behavior problems and go down the list that all vets have to see if they have some type of a dementia.